Hello everyone, this is Rasha, and today we'll be presenting an interesting case of the week. This is a 71 years old who is coming from a nursing home with a complex medical history including end-stage renal disease on hemodialysis, still makes urine, hypertension, CVA, AFib on Coumadin, history of DVTs, aspiration pneumonias as well as frequent UTIs. I guess every one of us sees one of these patients almost on daily basis. This time presents with a fever up to 101.6. The patient endorses very limited history but complains of some back pain. Given the history of frequent UTIs and aspiration pneumonias, these were the presumed causes of the patient's presentation, and the workup was started, including inserting a Foley catheter to evaluate for the urine for signs of infection. A Foley was placed, but there was no urine output. Therefore, a bedside ultrasound was performed to evaluate if the balloon was within the bladder. This is the bedside ultrasound, a transverse view of the bladder. And you can see there is hyperechoic structures within the bladder forming abnormal speckles concerning for pus collection within the bladder itself. And that might be the reason why there's no urine output. I just wanted to demonstrate side by side. On the left side of the screen is a normal bladder, on the right side of the screen is how the bladder appeared in this case, and you can clearly see that these speckles look abnormal. A CT scan was obtained and showed loculated complex fluid collection in the bladder, which represent infected fluid. There are also multiple pockets of air concerning for gas-forming organism and some left-sided hydronephrosis secondary to urinary outflow obstruction from the complex bladder content. Therefore, the diagnosis of pyelonephritis with left-sided hydronephrosis and pus within the bladder was made. The patient was admitted and treated for complicated pyelonephritis with IV antibiotics and saline irrigation of the bladder, after which the pus within the bladder resolved. This is a representative of a repeat ultrasound prior to discharge showing a Foley within the bladder and a normal bladder contact, and the wall appears normal and thin. And this is another sagittal view of the bladder. So this is a simple case where ultrasound help in guiding the management of the patient in the emergency department. Please send us your feedback on our email and let us know if you have any interesting cases. Thank you.